Hello, hello, hello. I'm going to get some people some time to log in. It's Dr. Pam, and Dr. Pam is doing a live today. Of course, oh, Dr. Pam's headphones, they're pairing. That's okay. Let's hope it works. Okay, let me check this sound here while people are coming in. Hope my beats are paired. Some people some time to log in. Let me just check my speakers. I do. So hi guys, it's Dr. Pam, and if you are watching, sorry about that. Somebody's asking me where I am videoing from. So let me see. So it's a Facebook Live, and I will put this in the chat box of where to find me. So guys, I am just going to be right here, and I'll let everybody know where to find me. Hopefully we can get people in and asking lots of questions. So it's Dr. Pam. I'm the owner of Academic Coaching for World Changers. And I am just going to start talking just about some content. Okay, so let me get 1 second and get this person in. Okay, guys, I think I'm in the right place, but I'll have to make sure that I'm in the right place. Oh, I see somebody coming in. So I think I'm in the right place. Yes, 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 I'm in the right place. Hello, guys. How are you doing? How are you doing? Thanks for joining me today. Normally, when you're in a live session with Dr. Pam, she makes you turn your camera on. But since this is a free session, I don't mind whatsoever. If you will tell me what test you're taking, I'm going to just put out some questions in general. I tutor to lots of different tests, but remember, the questions, some of them are very much the same. So that's really what we're going to work on is just some general how to answer the questions. I'm going to work on some family theories because sometimes those are ones that we struggle with. So knowing the verbiage that goes to a family theorist. Okay, I think I can share my screen here on this Facebook Live, but I'm not really sure. Usually I do it from Facebook Live, but I thought, let me try to go into Zoom and do it from Zoom Live. So I don't know if it's going to work or not. But I do want to always share information and share questions. So if you are new with us, if you've been watching our YouTube videos, if you signed up for some sessions with us, all that means is that you've got some one-on-one time with us. So I'm going to repeat, and I'll repeat it a couple of times, of how we really suggest that you study for the test. We believe that you should study 90 days. 90 days, 6 days a week. You really, really, really have to know content. It is that simple. You just have to know the content for the test. So no matter what test you're taking, and I'm going to open my chat box. It is open. So if you want to put a specific topic in there or tell me what test you're taking, feel free. But in general, I'm going to go over questions that are pretty much for everybody. So let me go back and just talk a lot about the study plan. So most of the people that tutor with us are those smart kids. You guys were the smart kids. You never ever had to study. That's the problem is you just knew when you were in grad school, especially, you just went in, right? And you were just able to start doing what you were doing and you really didn't need anything to study for. So you have no study skills. The kids who aren't so smart learned how to study. So for a lot of my clients, they just don't know how to study. Not your fault. You're the smart kid, right? However, what we do is we say to you that you're probably much more of an auditory processor than you realize. You really are. You know words to songs. What I'll say normally in a class is I'll ask you, hey, tell me the words to one of your favorite Michael Jackson songs. Everybody knows Michael Jackson songs. I can tell you since I've started asking that question, I've learned a lot more about the song Dirty Diana because I did not know those words before. But anyway, that's where I start. And people really are able to tell me the words to the song. And if we look at Michael Jackson, most of those songs came out in the 80s, early 80s, sorry, late 80s, 90s. That's what why do we still know those songs? Because we heard them over and over and over again. That's exactly how we know them. So the goal is let's try that with your learning skills. I know many of you have read, and I'll refer to the purple book. That's my NCE. That's been the Bible forever. And some people will say the APGAR book. That's the Bible for social work. Those are our content people. And I will totally agree. They are really, really good on content. They're just not so good on how you answer the questions. So that's the problem that you're stuck and you don't know how to answer the questions. So a lot of people, again, my social workers study the APGAR many times, which is again a great book for information. They will also study the my NCE people or NCH MCE or the counselors will study the purple book or the orange book, whatever it is now. The problem is, though, those are not the way the test questions are written. So you might have studied, but you get there and you have no idea how to answer the question because the questions are so vague. The goal is to make sure you understand what theorists say what. Okay. Knowing that if I'm talking about, especially families, knowing structure and strategic family therapy, those have different verbiage. And the way to answer those questions is really going to be based on the verbiage that they use. So that's our goal is to learn what that person would say. Okay. So then we're going to always match terms with the verbiage. Hi, guys, come on in. If you are more than welcome to put a question in the chat box, I do not mind at all. I'm going to pull up some questions. I'm just in general talking about study guide techniques and how you study. You'll also see that my chat box is on. My closed caption is on. Okay, so if you do that closed caption, then you can actually see my words. And remember, part of this is trying to grow your vocabulary. Okay. So of course, when I'm on live, that's when one of my kids wants to call me. So I'm going to put this question. We're going to look at this question. I'm going to start a list of questions and just kind of talk about how we look at them. Now, many times I'm going to use counselor or social work questions. I use them vice versa. The difference with the social work, of course, is we won't have those careers. And there's there are fewer questions on the work doc. There are fewer questions on research on the social work guide as well. Okay. Well, let me just open a new. Does anybody want to ask me a question? You are more than welcome to. Okay, I'm going to share my screen in just a second. We're just going to again go through some questions. Okay. Let me try sharing my screen and let's see how it goes. Can you guys see my screen? Can you give me a yes or a no?
Yes.
Heads up at them. Thank you very much. I appreciate that. Okay. Okay. I'm going to read the question out loud. I'm going to teach you how we read questions. No matter what test you're taking, you are learning to take a standardized test. And no one everywhere, anywhere, ever cares what you think. Until you see your name in the question, they don't care. Sorry to tell you that. We don't care. What you can do is you can bring your job, the test into your job, but you can't do it the other way around. Okay. So remember that the test doesn't care unless you see your first name, last name in the question. We don't really care. I got to answer this text real quick. Okie dokie. So the question says a 16-year-old male is discharged from the hospital and referred to a social worker. And again, it doesn't matter if it says counselor, the processes would be the same. So a 16-year-old male is discharged from the hospital and referred to a social worker for cutting his wrist with a kitchen knife. Okay. When the social worker talks to the boy about the incident, he explains that that cutting feels good. He also says that he does not know if he can stop, noting that is the only one thing that makes him feel good anymore. What's the best response from the counselor, the social worker, the LMFT, whatever your profession is? It doesn't change. Okay. So what I'm looking at is I'm going to spend more time in the question before I go to the answer. So then I know it's a 16-year-old male. I know that he was just discharged from the hospital. So this is like case management, follow up, right? Making sure that he's okay after the hospital. And I say to him, hey, tell me about the incident. And he says, hey, it really felt good. So my first concern is he might do it again because it felt good to him, right? Okay, it felt good. So then what I'm going to do is, now that I understand the question, I'm looking for the best answer. So what I know with a best question is there's probably more than one right answer. So you see, this one only has 3 answers. So some of the CPCE tests only have 3 now, and some of the social work exams also only have 3 questions. Somebody said somewhere that 3 was easier. I don't believe that for half a second. I definitely think having only 3 choices is harder. That's just my opinion, though. So then I know there's a 16-year-old. I know that he's cutting his wrist. And how do I best respond? A, prompt the boy to answer all explanatory questions related to the functioning of his self-harming behavior. B, provide him resources about cutting. Or C, have him placed on the social work on a psychiatric hold. So let me go back to the question. Really, it's a reading test. If I haven't mentioned that in the last 5 minutes, I'll mention it 10 times today. It's a reading test. We go back to the question. How do I know what they're asking me? How do I know how to answer? So then I know that he's 16 years old. I said earlier that I thought that maybe he'd had discharged, but let me read it again. He's referred. No, he's discharged, right? He's discharged. So I know he's no longer in the hospital. And my first thought is this may be a case management question. May not. I don't know, but that's what I'm thinking. So then let's keep reading. A, prompt the boy to answer more exploratory questions regarding the function of his self-harming behavior. That's my assess question. Remember, we get paid to be nosy. That means we get paid to be nosy. We get paid to ask the questions your mom and him said don't ask. Okay, so that's exactly what we're talking about. We get paid to be nosy. So then, let's see here. Provide him with resources about cutting or have him placed on a psychiatric hold. Now, for many of us, what we do is we really just stay down in the question. We look at the 4 choices and we're staying in the choices. We're trying to figure out, okay, of the choices, what's the best choice? But we don't go back to the question. Would anybody like to take a guess? Put your answers in the chat box of what you think the answer might be. Oh, be brave. I see a couple of A's, K's, A's. Okay. So let's make sure we're not doing groupthink, right? Groupthink is where we know we're going to vote like everybody else does. If you're not sure of that term, because we're always learning new terms and new terminology, let me show you what that looks like. And just open one of my browsers because I have about 4 screens and I have all four screens open. So we're going to just kind of share the browser. Those of you that are coming in, there's a question on the screen. I think I made it too small. There we go. That's my question. I'll also put it in the chat box, so it'll pop up on the chat box for you if you're struggling with my screen. And most people said A. Okay. And what I just said to you, though, is let's make sure that we're not using groupthink. So what I want to do is show you what groupthink is if you're not sure. So groupthink is something we're all guilty of. Groupthink is when everybody in the group says, "Oh, come on, Pam, let's go out to lunch. Let's go here. Let's go here." And it's like, "Oh, maybe I really don't want to go," but I don't say anything because I don't want to upset the group. I like group amicability. So you might see a question of writing groupthink that says a director puts puts a confederate or puts someone who is going to always disagree with him. They're going to put that person in his group or in his meeting, because what happens with groupthink is many times we will just go along with it. We don't want to rock the boat. We're just going to stay with what everybody said. So that's very common. So that's why we try to avoid groupthink by putting in, sometimes it'll say a confederate. Sometimes it'll say oh, my question went to the waiting room. Okay. So sometimes it'll say a confederate. Sometimes it'll say something like someone who will disagree with him. But the goal is if one person disagrees, then somebody else is more likely to disagree as well. Okay. So then with this question, I'm going to go back to the question. Okay. So at this point, A is going to be my very best answer. Okay. I want to gather more information before I do anything. We get paid to be nosy. Remember that. So you're in this field because we ask questions all day, every day. That's exactly what we do. All day, every day, we ask questions. Okay. We get paid to ask the questions your mother told you not to ask. Okay. Okie dokie. Let's just do again some other ones. Okay. We're spending a lot of time just learning content questions and what they look like in a question. And again, I'm using questions just that are psychology questions, so they could go to any one of the tests that you're taking. I'll put this one in your chat box as well so you can see it. Okay, so this one says, Stacy experiences both anxiety and depression. This is called what? She's got both anxiety and depression. Okay. Is it called illusory correlation, confirmation bias, comorbidity, or effort justification? Yeah, I gave you an easy one. Okay. So this is comorbidity. This is just a simple recall question. Make sure that you know your verbiage. Comorbidity is different than co-occurring. Co-occurring, that used to be called dual diagnosis, was a combination of drug and alcohol as well as a mental health disorder. Now it's called co-occurring. Back in the day when I was in school, a million years ago, dinosaurs roamed the land, one-room college, that we really believed that you treated them separately. We believed that you had to get clean before we actually could treat you for anything else. Now we have dual diagnosis places, right? Places that you can go in and be diagnosed, be treated for both at the same time. So we do have dual diagnosis places. So that's co-occurring. Pre-morbidity if you had a underlying issue before COVID happened, you got the shot first, right? So pre-morbid means I had this that maybe led to this, right? If I had an autoimmune disorder or something going on, I was in line to get the shot first because I was at higher risk. Comorbidity means two issues at the same time. It can be two mental health issues. It can be two physical health issues. It can be a mental health and a physical health issue, just not drugs and alcohol. Drugs and alcohol is co-occurring. Okay. And of course, then post-morbidity, that means after. So there are people, and you probably know some people that had COVID, and afterwards they developed. I had a client who developed actually Bell's palsy, and the doctor thought it was related to COVID. She'd gotten rid of the COVID. However, she was still having some issues, and they thought it was post-morbid. Okay, so again, just learning terminology. Guys, if there's specific content or something you want me to answer, just put it in the chat box where you want to ask me a question. You are more than welcome to unmute yourself and ask me. I don't mind at all. Okie dokie. We're going on again. If you're first time with me, let me introduce myself. I'm Dr. Pam. It's Dr. Pamela Janine Winton-Turner. I am the owner of Academic Coaching for World Changers. My business is 6 years old. I released my first video, well, maybe 5. Yeah, no, 6. I released my first video in December 2018. My friends said, why are you giving away free videos? Like, I just want people to learn. I want people to learn. I just wanted, and I still to this day believe this stupid sheet of paper should not stop you from passing the test. I believe that you were called for this. Jeremiah, whatever your biblical beliefs, but Jeremiah says that he knew you when you were in your mother's womb. And most of the people in this field have gone through some stuff. All right, we got some battle scars, especially if it's our second career, but most of us, even our first career, we got some battle scars. That makes us more empathetic. We're really able to understand what it's like to really be struggling emotionally and nobody know. Many of us saw a counselor, right? And really that is the goal, is just to be able to put ourselves in those shoes. So most of us got some stuff. Okay, that's why we're in this field. But I also believe that this is your path. And this is a stupid sheet of paper. What things people most often do wrong has to do with bringing themselves in the question. They talk a lot about what my office, we do this. Unless the question asks about your office, we don't care. Sorry. Okay, I didn't make it up. We just don't care unless it has your first name and last name. We study white old men that have been dead 100 years, except for reality therapy, right? That's our newer therapy. If you see postmodern, that's what they're talking about. Reality therapy. That's Glasser. So in WDEP, those are the wants, right? That's the acronyms that go with reality therapy. So the goal really is to understand the questions and understand how to answer the questions. And it's not about you. You may do some form of narrative therapy in your office, but unless you use the verbiage that a narrative therapist uses, you're going to miss the question. Narrative therapy talks about taking this story, this story I have in my head, right? I've got this story. And what I usually try to describe it is if you grew up with siblings, right? You had siblings, and sometimes you're sitting around talking to your siblings, and they're like this happened when we were little. Where'd you grow up? That's what happened. If I can relate to that, you got some siblings, you're like, I have no idea what you're talking about. So I have constructed my narrative. I've come up with my story. And while my story may be different from my brother's, it's still my story. So constructivist, that means that you've developed, we as a country, we as a nation have constructed this theory. So if my construct is that, oh, you know what? Mama loved him the best. Right? That's a story I keep telling myself in my head. So a narrative therapist would really take this problem-laden story, right? So you're telling yourself the tape you keep playing in your head over and over and over again. My mom never loved me. She never loved me. She loved my brother's best. And this tape keeps getting in the way of my life. So what you're going to see, first of all, is you have to then externalize the story. take your cassette player, hit the eject button. If you're not old enough to remember, there's these things called cassettes. Okay. If a boy really liked you back in the day, he made you a mixtape. That means he had to wait for the radio station to play the song, right? And he'd hit play and record at the same time, and he'd make you a tape. So we're trying to learn to rewrite and make our own love tapes. So the goal is I'm going to externalize, take it outside of my head. Then I'm going to deconstruct it. I'm going to take it apart. Where did that story come from? How come? What's going on here? I'm going to clarify and reauthor. That's the verbiage that belongs to narrative family therapy. So if you tell me I'm going to rewrite my story, you're probably going to miss it in the question because you haven't used the verbiage that belongs to narrative family therapy. Okay. So as we go along, that's what we're going to talk about, is learning the verbiage of the theorist. And Nadine, I'm very sorry that this has been your fourth time. I hope you get with one of our get one of our coaches and really figure out what you're missing, and let's get this done. We believe in one and done. Don't waste it all your money. Shoot, test it $275 a pop. If you take that test 3 times, I could buy me a pair of red bottoms for that. Just saying, okay? And most of you spent tons of money on material. Don't do that either. If you tutor with us, we provide study material that you need, and it's going to be focused really on just what you need. Okay. So I'm going back to my question. Humanistic theories are also most likely to involve. I know you read all 4 of those questions already. I know the answers because you're down in the answers, but I want you to stop doing that. I want you to stay in the question first. You're not trying to make the answers fit. You're trying to understand what the question is asking you. And I hate these one lines. I would much rather have, those longer ones any day. These one lines, whoa, kick my butt. So then I'm going to, again, humanist therapist. So in my mind, I'm thinking, okay, here are my humanists. Okay. So she said, the goal is my humanists are anybody that put people first. Maslow's theory, when it came out, was highly controversial. I know, right? Who never disagreed with that? Maslow's theory talks about, sorry guys, I need to get some water here. So Maslow's theory talks about putting people's needs first. Remember that one? So Maslow is a humanist because he put people first. However, when this theory first came out, this is the same time as Carl Rogers, the same time as all those big people, Freud, right? All those people said, what do you mean people don't have food? What? That's ridiculous. Remember, they had only worked with very wealthy people. They had never worked with anybody that didn't have food. So it was actually very controversial when it first started. So what we know is that we like that now, right? We like putting people first. So let me just pull up Maslow's theory for you. Maslow is just one of my humanists. The other humanist you're going to see would be Carl Rogers, right? Carl Rogers puts people first. And we're also going to talk about Virginia Satir. We see her in families. So whenever you see a question about the humanist, that's who I'm talking about. Okay. Do you see my hierarchy here? Am I sharing my screen? Just give me a nod, a thumbs up or something. Thank you very much. Thank you very much. Okay. So one of the things that we know now is we call them B needs, D needs, and B needs. That's kind of new. So we didn't do that before. The theory hasn't changed, but remember, we talk about B needs and D needs. So PHY, physiological, means physical. Whenever you see that word, it's physical. So don't get it confused with psychological. It's physiological. So what I'm looking at is making sure that you get your basic needs met. Those are called now, my D needs are called my deficits. Okay. So physiological, food, clothing, shelter, place to sleep tonight, not in my car, all those good things. Safety needs also means not in my car. right? If I'm sleeping in my car, I'm not safe. Safety needs also mean I trust that my school is safe. I trust that my job is safe. Then we've got the, oops, go back. We've got then our growth needs. And this one is pretty thorough. You won't see all these on the others. But remember, D needs are my deficits. And the D needs are my deficits. And the B needs are the growth needs, being a better person. Okay. So D needs, B needs. And remember, for my career people, that Anne Rowe did her theory of fields and levels based on Maslow, right? The field part, how you grew up, what kind of home you grew into, that is definitely a Maslow. That's totally the field is Maslow. The level is your unconscious, and that might seem as Freud, but the field. So we know that he is a humanist. Okay. So I'm going to go back to my question. And again, guys, I am not about you getting the questions right. So many of you spend so much time getting the questions right. If you learn the content, you can get every question right. And that's our goal, is when it doesn't say the person's name, do you know what theory they're talking about? Oh, that's too big. Okay, so then I'm going to read it again. So I knew what I said before is humanistic theories are most likely to involve. I know those are people that put people first. So humanistic theories are most likely to, humanistic theories are most likely to involve, okay, I'm sorry, I make A, encourage the client to carefully observe the consequences of their maladaptive behavior. B, focusing specific attention on clients' positive and negative feelings toward their therapist. C, emphasizing the importance of self-awareness for psychological adjustment. Or D, helping clients identify a set of anger triggering situations. So let's mull over all four of those. And what I will say to you, we're always going to rule out two. The question in the box says, what made this question more Maslow than Rogers? I don't know that it's more Maslow than Rogers. I was giving you a list of humanistics. So this question should talk about all people that put people first. So that's, again, Carl Rogers, Maslow, Satir. So when I see human development people, ages and stages, Erickson, right? In my human behavior, Erickson, Freud, Kohlberg. And in careers, right? We talk about supers careers. Those are all ages and stages. So those are developmental theorists. They talk about where you should be at this stage. And for example, like Erickson, and I'll pull up some Erickson questions, but the goal is that you know where you're at in Erickson. And then when you go to the test, you're able to recognize it because you see it all the time. In your clients, you say, hey, according to Erickson, you're identity versus role confusion. That's between 13 and 21. Don't memorize them because ages and stages won't match up. You've just got to know the content. Okay. So then back to my question. Humanist therapies are most likely to involve. So then I'm going to rule out. That's what I'm always going to do first, is figure out what it can't be. There's no way, no how that this is my answer. Okay. I'm going to take out A for sure, because whenever I see maladaptive behaviors or consequences, that's a behaviorist. That's Skinner. That's Pavlov. Those are my behaviorists. They don't care about how you feel, just care about changing your behavior. So humanistics care about how you feel. So definitely I'm going to take out A. Okay. Let's see here. What else can I take out? Focusing a special attention to positive and negative feelings toward their therapist. What's that called? That's transference, right? That's just simple transference. When I bring my stuff, the client brings their stuff into the session, right? Or they're talking, whether it's good or bad. Transference is neither good or bad. It's just either adding or taking away. Remember, positive and negative, just adding or taking away. C, emphasizing the importance of self-awareness for psychological adjustment. I kind of like that one. And D, helping clients identify a set of anxiety triggering situations. Oh, okay. So let's talk about this. So I'm thinking that D is very, very specific. And I gave you a list of humanistic people, And yes, maybe I can use them with anxiety, but is that the best answer? And I'm always going to say, when we get down to 2, we're going to go back to the question, right? Go back to the question. Help me figure out what's happening here. Humanists put people first. Carl Rogers, he is the guy who did person-centered, client-centered, right? He purposely came along after Freud. Freud came along and said, yo, women, I'm the expert. You poor dumb women, just listen to what I say. Right? He's the sex guy. Whenever you see a sex question, that's Freud. Neo-Freudians did not believe in the sex stuff. Neo-Freudians did not believe in the id and the superego fighting back and forth, right? They just believe in the unconscious. So I know that Carl Rogers came along and said, no, Freud, you are not the expert, boy. The client's the expert. It's their life. If I sit back, if I just let them talk and talk and talk and talk, if I do unconditional positive regard, if I do non-judgmental attitude, and I do empathy, if I am able to put myself in the client's shoes and understand why they made that decision. Okay. So that's the hardest part for us. And as counselors, we're much better at it than lay people. But you know, when the mama leaves her kid in the car and she goes to get high and the kid dies, right? So she gets a counselor. She gets someone that says, hey, you know what? I'm really sorry that happened, and I'm not going to judge her. I know that everybody in this room has used Carl Rogers. I know that you have heard stories that your insides were freaking out. And you're like, no. I did not mean to mute myself. So you've all heard the stories. You've heard the stories. You do this for a living. And you didn't go, ah! You were congruent. The look on your face matched your feelings. And what I teach my young college kids is just say, thanks for sharing. If you're not really sure what to say, you know, we've all worked with the stories of, you know, putting the baby in the bathtub. I had a woman one time that had her youngest daughter, long story, but her youngest daughter had drank acrylic. She was doing her nails at home, and you know, her man came home and she had made dinner, and her man didn't want dinner, not the baby daddy. That man didn't want dinner. So she told the baby, 2 years old, to stay on the toilet, the little potty, stay on no, it's on the toilet, stay on the toilet, stay on the toilet until I get back. He's 2. First of all, 3 is when we want potty training to happen. I don't care what your mama said to you. The answer is 3 for the test, right? So the little girl drank acrylic. You know, it hardens your nails. It hardened everything. She had a trach. She almost didn't live. And I had to work with that woman to help her get custody of that children and other children. I can't be judgmental. That's not fair. That's not fair. So Carl Rogers said, if we wear that hat, if we do that and let the client talk and talk and talk, the client will figure it out by themselves. All I have to do is show unconditional positive regard, non-judgmental attitude, and empathy. And he called genuous being congruent. So congruent is when my mouth and my body line up, right? So what's coming out of my body, what's coming out of my mouth matches my body language. So he called that, it's congruence, but he used the word genuineness. So again, that's a hint to know a Carl Rogers word and a Carl Rogers question. Okay. So again, so that's Carl Rogers, came along after Freud, client-centered, person-centered, didn't do anything. The client can figure it out all by themselves. Think of Mr. Rogers' neighborhood, right? It's okay in the neighborhood. Things okay. You can tell Carl Rogers anything. But what I want you to do is when you go back to work on Monday or seeing clients this weekend, use it. Say to your client, well, I'm going to use a Carl Rogers technique, or according to Carl Rogers, I'm just going to be empathetic. Tell your boss, hey, you know, this last client I had, I really put on my Carl Rogers hat. I was really client-centered. I'm never teaching you anything you don't know. This is not brain surgery. I am not teaching you to pull teeth. I'm teaching you the words of what you do already. Take the language of the test and put it in your everyday vocabulary. That's how we learn it. Okay, so I'm down to C or D on this question. Anybody want to take a guess? Put your answer in the chat box for me. Be brave, be brave. I only got C or D. My answer is C. Okay. So B is just a little, is very specific. And if it's an anxiety triggering situation, especially if it's a phobia, I'm going to use something else. With the phobia, I'm going to use systematic desensitization. So any of the phobias, feel of spiders, being afraid of spiders or snakes, or I don't care what it takes, all those things, I use either systematic desensitization or I'm going to use flooding. Joseph Wolpe, and sometimes you'll see in vivo desensitization. Okay, so Wolpe, there we go. So Wolpe said, if I have a phobia, and that's an unrealistic fear, okay, I'm afraid of spiders, I'm afraid of snakes, I'm afraid of anything. The biggest one is my kid's getting married and I need to get on an airplane. That's the most common one I see. So now I've got this person who needs to get on the airplane. So flooding is all at the same time, right? Flooding is I just threw you in and you figure it out all by yourself. Okay. So then the other one is going to be systematic desensitization, which is slowly. What you're going to do is you're going to use between 5 and 10 steps. It's sometimes called SUDS. Okay. It is the subjective distress scale, subjective something distress scale. I'll have to look it up. So the goal is I'm looking at reciprocal inhibition. Reciprocal inhibition means I can't be stressed and calm at the same time. It's just not possible. So if I've got someone that I'm worried about them, you know what I'll do? I see you guys trying to look. I'll put this link in the chat box. Okay. So feel free to just use the link I'm using. That way you can look at it on your own end. So, okay. So what I know is I am going to come up between 8 to 10 things with the client that they're afraid of. I'm going to first teach them to relax. So I'm going to use those relaxation techniques, whether it is guided imagery. I don't want to mute somebody. Whether it's guided imagery or whether it is grounding techniques, whatever you would use to whatever your skill is at teaching people to be relaxed. Okay. I like going to my happy place personally. So I definitely like, closing my eyes and pretending I'm at the beach. That works for me. But I'm going to make sure we teach them relaxation skill. So what I'm going to do next is with the client, I'm going to come up with this list. This list is going to be the list that the client decides. We work on it together. So then the first thing is think about a spider. Second thing is look at a photo of a spider. So all of those things are what I'm looking for. I said SUDS. It's called the subjective units of distress. Okay. No, this is a live. So it will not be on later. I don't know if we'll post it free to YouTube. I can't promise you that. But yes. Yeah, but it will be posted. I don't know when. I don't know if it's going to go up today or 6 months from now. So it's a live session. We don't often do these. So, okay. So then what we know is with the system, the subjective, it means it's the client's belief system, subjective units of distress. So that's what this list is. And I use the term, go back, make sure you get the terms. I use the term reciprocal inhibition right there. That's the term I use. What that means is, again, terminology matters. So what it means is you cannot be stressed and anxious at the same time. So what I'm going to do then again is work with the client to come up with their list. And what we're going to do is the first thing we're going to do is I'm going to have him think about a spider. Okay. Just think about it. Just think about it. And the goal is as they're thinking about it, their anxiety is going up. Oh my gosh, I can't imagine a spider. I can't imagine a spider. And as that anxiety goes up, I'm going to go back to the relaxation technique we've already worked on. Okay. Ground yourself. Grounding technique is usually with bipolars or anybody whose anxiety is off. So grounding yourself is literally sometimes touching the ground, touching something that you know is real. So again, I like guided imagery. So the goal is then we go to the next step. the next step. Now we're going to look at the photo of the spider. When they get anxious, I'm going to take them back to their happy place. So between 8 and 10 times is what we're going to do to help the client realize how to get over those phobias. Okay. So Joseph Wolpe he's considered a behaviorist. And remember, behaviorists could care less about how you feel. They just want to change your behavior. Okay. Okie dokie. I'll pull up some more questions. Is there anything in particular you want me to go over? A question you've seen someplace that you want me to answer? Feel free to put it in the chat box. I do not mind. Especially if you just recently took the test and there's a question you're like, oh, I don't know where that came from. I don't know what that means. I can help you with that. As we talk about getting ready for the test, we talk a lot about anxiety. One of the things I always want you to remember is you cannot pass this test if anxiety is kicking your butt. I didn't make it up. It's a law. Like gravity's a law. That's called the Yerkes-Dodson theory. I'm sorry, Yerkes-Dodson law. It means it's like gravity. It's a law. So what it says, and the research really started off with with athletes. But what it says is I cannot function at my peak if my anxiety is too high. It is that simple. Okay. So there's lots of research done on athletes and people who like really blow it at the last minute. Okay. So blowing it at the last minute is because my anxiety gets there. I missed the free throw. I missed the shot. I fumble. I bet you guys have been watching like Simone Biles at the Olympics. And one of the things she's really talked about is her mental health, right? She said she got the twisties, which is anxiety. In order for her to perform like she's done this year, she's amazing, right? You see all those medals? Go, just say, okay. She had to get her anxiety in check. And I will tell you the same thing. If you don't get your anxiety in check, you can study your butts off and you still won't pass. If you don't learn to trust your gut, trust what's going on, okay, there are going to be some questions that you know the answer to because you spent 6 years in school. You might not recall how you know it, but you spent 6 years in school and all y'all had a 4.0, 3.98, 3.8, maybe if you got a B in stats and research. You know stuff. Trust the gut based on the question. And with anxiety, you can't do that. So I'm always going to say to you, not only for you, but also for your clients, your family members, get accommodations. You don't have to be on medication, but I suggest you treat it. Why would you take this test over and over and over again and I can't breathe? If you've not ever had a panic attack, you can't breathe. You cannot breathe. And all the worst thoughts ever are going through your head. See your doctor. Ask for the accommodations. Be very specific. We want 2 extra hours and a private room. I will put a copy of the questions in the end, but I'm not going to do many questions. I'm doing more teaching than questions because everybody just wants to do questions and that's not studying. I want to teach you content. But yes, I'll put a copy in the end. But I want to teach you content. Okay. So then, girl, you a therapist? Oh, okay. I have undiagnosed dyslexia. Okay, so I'm going to tell you that was going to require testing. However, what I will say, I'll be 59 in October. My bladder's like this big. I just tell my doctor, please write a letter to give me 2 extra hours so I can go to the bathroom. I can't. I'm old. My bladder ain't big enough. So again, a medical issue works just as well. You don't have to have a diagnosis. You do not. You can have generalized anxiety symptoms. If you're going to go with dyslexia, they're going to ask you for either proof in college that you got help, or they're going to ask you to prove some testing. I've had people do the testing. It's about $1,500 and it's not covered by insurance. And I'll be honest with you. I don't know if they were glad they did it, because sometimes seeing it in black and white, knowing that you have a master's degree and you understand on the 5th grade level is sometimes scary. So I say that to you. If you think it's worth it, invest in it. I had a client who she hated me. Oh, she hated me because I told her she needed testing. She hated me. But that's only she passed the test. When she got the accommodations, you know, she had PTSD and some other learning difficulties. So she got a reader. She got a reader. Okay. So again, if you just have to have proof that you need a reader, but the basic one is 2 extra hours and a private room. I'm Lady D. My Vyvanse is going to wear off probably by the next hour or so. However, I can't sit still. I need to talk out loud. I have a standing desk because I can't sit, and I'm on medication. So I need to get up. I need to move around. I need to talk. I need to talk out loud. I need the private room. That's how I learn. You'll see I talk with my hands. I'm everywhere. And when I'm trying to remember stuff, I'm down, I'm thinking, I'm okay, where was it right? I can remember where I was when I saw it. I need that to perform at my peak. Okay. Get medication. There's a couple of things that have low blood pressure, that lower your blood pressure. ADHD medicine. Girl, I'm a huge, I think I have old ladies. I'm a huge fan of just getting me a little Xanax. Okay. Just don't take it the first day of the test. Ask your doctor about first, maybe 5 or 6 pills. That's what I want you to do, is take it when you're studying. A lot of people, when they meet with me individually, they get anxious. I know I don't try to make you anxious. I don't. But they're kind of not as embarrassed. So I'll say, if having an individual session with me causes you anxiety, you're not going to pass the test. You've got to treat it. Get a therapist, get a doctor, therapist, go see somebody. Okay. So then the goal is that we look at this theory. So this is called the Yerkes-Dodson law. And what it says is that more I am stressed, so my arousal, low arousal, you ain't studying nothing. Okay. You ain't doing nothing. Let me go to another, that one. Okay. So optimal performance is when you have a little bit of anxiety, a little bit. I want you to wake up that morning a little stressed. I do. Right? That gets your juices flowing, that you're good. Hey, I'm out there. I want you to. However, I don't want it to be so high. So what this theory says is when it's so high, I can't perform. I impaired performance because of strong anxiety. And remember, this is higher level thinking. This is not putting on your clothes. This is not starting your car, things you do every day. This is higher level thinking. When you have to perform at your peak, if you don't take care of it, you're not going to pass. Okay, I'll tell you that right now. I will also believe that a lot of my students have PTSD. They have gone to the same location 5, 6, 7, 8, 9, 10 times. And the problem is you keep going back to the same place and it triggers something. You can't sleep the night before. You can't sleep the week before. So if that's happening, find a new test location. Oh, and A, see a counselor. See a counselor. Okay. Stop trying to act like your anxiety isn't real. I will let you know, by the way, that test anxiety is not an accommodation. You have generalized anxiety, free-floating anxiety, GAD for the test, 6 months free-floating, not tied to anything. But what's happened is you have paired it, right? A classical conditioning, that's Pavlov, the dog. You have paired a response with the test. So now whenever you see test questions, when it's the day before, oh my gosh, you're on Facebook and somebody fails, you automatically go into full-blown panic because you've paired those two things together. So test anxiety will never, ever get you approved. You have generalized anxiety that is paired with the test. And most of you have it. You can't sleep the night before. You're struggling, right? And not even the night before, it's weeks before. What we also say is, please don't study the day before. Girl, and one day, if you don't know it, you don't know it. We really believe in 90 days. If you want to look over it briefly, that's fine. I've had a couple people that'll say they'll listen to my videos on the way to the test. I need you to be your best mind, body, and soul. Okay? So that literally means relax. I suggest to my single mom, or my moms, get a hotel room. You know what relaxes you? Your spouse. Get some blood flow into the nether regions that will relax you. That's what you need. No kids. And if your spouse causes you stress, then go away by yourself. Get a hotel room the night before, get a pedicure, get a manicure, watch mindless TV. You've got to be at your best to be able to pass this test. Okay. So yes, English is your second language. So if English is your second language, some states will recognize that, some states won't. So they'll let you bring the states that'll recognize it. You have to prove when you came to the country. If you've been here 24 years, that sorry, they ain't gonna count that. Okay. If you've been here 10 years, that's a different story. And they will allow you to bring a word for word dictionary. And it's not the clinical words. It's got maybe 500 words. So it's the everyday word for word. It's not clinical terms, but usually if you get approved for accommodations, they'll let you use that. New York will not accept second language as accommodations. So if you get licensed in New York, if you get licensed in New Jersey, and New Jersey does allow the language, and you move to New York won't recognize your license. Okay, so you have to make sure that if you're looking for reciprocity down the road, that some states will not allow language as a second English speaker. Sorry, ESL, English speakers as their second language. Okay. Hey, as I'm saying, Latanya, that's really one of my clients told me that, girl, you know what I did today for the test and the morning for the test. Just so. Okay, so it works for her. Relax. I want you to be at your peak performance. I refer to this as our Super Bowl. You can keep going to school. I have a doctorate degree, but I can't get higher than my LCSW. So when I'm there, that's the peak. Every moment I've been waiting for, everything I've studied, everything I've done is to get to this point. And one of the things that I always try to remember is teach mindfulness. I'm sure on one of my videos, I talk about it, that I took my test 1,000 years ago when dinosaurs roamed the land. Okay, I'll actually say it was 33 years ago. So I'm old. But I definitely just remember before I put my number 2 pencils, I just looked around the room. And for me, mindfulness was gratitude. There were so many days during grad school and undergrad school that I wasn't even sure I was going to be in the room. Classes that I was barely passing by, and we didn't have internet back then, and I had to drive. I lived in Fort Lauderdale. I had to drive to Miami for some graduate school classes. Girl, I didn't have money to pay the toll. I like throw my hand in, just praying I don't get tickets. I did get tickets, but I just was so thankful that I was in the room. And I want you to make sure that you take that gratitude moment or mindfulness. Just enjoy the moment. Remember, when the guy leaves, you don't have to start the test right away. You can wait. Get yourself together before you start the test. Okay. If you're at home, anybody taking the test at home? I love taking it home. I do love it. I think it's great. However, be very, very careful. You cannot move your lips. So you cannot talk this at all. You can't move your lips because they think you're talking to somebody. If you stare at any direction too long, they definitely think that there's someone in the room. If your dog walks by, they're going to beep you because you're sure that your dog has some answers written in his fur. So I love it. I love it at home, but be careful of the rules. If there's any kind of computer issue, it's your fault. Hurricane can wipe out your entire neighborhood, but it's still your fault. So be sure that you read the rules. Okay. I've had lots of clients who love it. I personally tutor about probably 80 clients a week. My business, we tutor about 120 clients a week. So we're very good at what we do, by the way. Most of my staff members were taught by me. So we're very good at what we do. But yeah, those are just the rules. So take your time, read the rules if you're taking it home. That's simple. I see some questions about broaching. Broaching is a newer term. Broaching means what I'm going to do is I'm going to approach the client, asking him questions about the socio-political climate. Okay. So I'm not taking a political side. So we see that, let's say that Trump should win. There definitely might be some changes. There might be some changes in abortion laws. There might be some changes in some LGBTQIA laws. So if I've got a client that's a member of the community, it's a marginalized population, instead of waiting for him to bring it up, I'm going to ask him. I'm going to approach the subject. I'm going to talk about it in my assessment and every time I see him. So that's broaching. Be sure that you go to the client and don't wait for him to bring it up. Okay, don't wait for him to bring it up. Wait for bring it up yourself and ask. So, is there something in the climate? If you're LGBTQIA and I live in Tennessee. If you live in Chattanooga, Tennessee, you got to keep your mouth shut. Okay, we in the South. So I'm going to talk about that with my clients. So that is broaching. Bracketing is another term that's new. Bracketing is when you check your values, morals at the door. Okay, so that is bracketing, and both of those are relatively new terms. I think I saw seeing it in textbooks in about 2010. So it's finally made it to the test. I'm a college professor. What's the difference? I'm not confronting him. So Nancy, I'm going to confront when your behavior and your mouth don't match. Okay, we do confront, but I'm not going to confront you on the first session. And I'm asking you, hey, is that an issue for you? How can I help you with that issue? So it's not confrontation. Confrontation is one of those active learning skills we will use. But remember that we're not going to use it in the first session, right? And if it's the first session of a group, right? And we're in the forming stage of the group, and I see somebody come in, and I know that there's a discrepancy in what they're talking about, I'm not going to say anything because I'm hoping the group members will pick it up. I'm not going to say a word. I'm just going to wait and really pray that the group members pick it up. Okay. So we very rarely use confrontation in the beginning. And also remember that when we do confront, it's going to be very clear what they said and what they did don't match. We're always going to believe the body. The hips can't lie. Now, if you've spent some time tutoring individually with me, you might have seen some of these questions. Okay, remember, I don't care if you get every question right. That is never the goal. Those of you that are doing Pocket Prep, the behavioral health app, and like, oh, I'm getting so much better. No, you're not. All you're doing is seeing the same questions over and over again. And now you've ruled out A, B, C, and D, and you know, A, B, and C, and it's got to be D. So your scores are coming up, but you haven't learned a thing. Okay. So then this question is, Stephanie, type 1 errors. So this is how I remember. 2AF. 2, bad word. Type 2 means I accepted the false when I shouldn't have. I did my research, right? I had a real group. I had an experimental group. The experimental group got the drugs. The control group got nothing. And then at the end, I looked at the results and my answer was not true, but I believed it. 2AF is to accept the false. 2A, bad word. 2, you know, the term. Okay. So 2AF is I accepted the false. Then type 1 is it was true and I didn't believe it. So I rejected it when it was true. Remember, so your significance level set at 0.05. So 0.05 means I'm willing to take out of 100 chances, other 100 times I do this research, I'm willing to take a chance that I missed it 5 times out of 100. So my P value or my significance is going to start at 0.05. If I lower my P value, my probability level, if I lower it to 0.01, that lowers my type 1 errors. You don't need to know more than that. Just memorize them. Just memorize them. Math are facts. You cannot memorize anything on this test but the stats and research. They're just facts. The bell curve, 68, 95, 99 will be the bell curve for the rest of your life. I had a girl who took the test today. I just talked to her earlier. And her first question was on standard error measurement. And so usually what I say to clients, if that first test question freaks you out, just, skip the first 5 and come back. She knew the first one. She knew the SEM. She'd had a group session with us when we went over stats and research. So definitely make sure you know those. There's on the NCE, there is between 22 and 30 questions on the assessment piece. and between 3 and 6 on research. And those are my easy ones. Just memorize them. On my social work exams, there's about 7, 8. Memorize them. They're just facts. Everything else you have to learn to apply. Okay. Okie dokie. So this question. The influence and principles of behaviorism in the field of counseling have been what? What that question mean? Oh my gosh. Don't go to my answers yet. Just think about my question. Okay. So when I think of behaviorists, I think I remind myself, hey, behaviorists don't care how you feel. They could care less how you feel. They just want to change your behavior. Positive and negative rewards, positive and negative consequences. We just want to change your behavior. We don't care. We don't care. Our people that are based on the people that we look at that are behaviorists are Skinner. First of all, we talk about like John Watson. John Watson did Little Albert. We don't see him a lot of the tests, but that was when he scared the heck out of the baby. That was at Johns Hopkins University, a major university. I just want to know what a woman said, hey, here's my baby, go mess him up. No, not me. So John Locke is tabula rasa. He said that when you're born, you're a blank slate. And we also know that the operant conditioning is going to be Skinner. Skinner said, I can change anyone's behavior with rewards and consequences. And then we know that the classical conditioning, pairing two things, that's going to be Pavlov. Right, so those are the behaviors. So that's what I'm thinking before I even look at any of the questions. I'm going through my head, behaviors. Now I'm going to look at all 4 of the questions. A, assimilated into the mainstream practice of counseling. B, a radical counterpoint to the humanistic element in counseling. C, avoided completely by insight-oriented counselors. Or D, employed to dehumanize clients. So now I ain't gonna lie, it did dehumanize some clients. It did, but that wasn't the goal. Okay? It definitely dehumanized little Albert. It did. That little boy who was afraid of nothing, and then at the end, he was afraid of everything white. So definitely I'm taking that out. So again, I'm looking for verbiage. A radical counterpoint to the humanistic elements in counseling. Yes, you're right. He was afraid of Santa Claus. Absolutely. So a radical counterpoint. Humanistic put people first, but behaviorist wasn't radical. It's just a different way of teaching people. Whenever you think of behaviors, think about your dog. Adler is the basis for, it's a question on the test sometimes. So systematic training for effective parenting, it's the STEP parenting program. It's been around forever and forever. It's a very old parenting program. And one of the things that we taught when we used that was that we just talk too much. We try to explain rationale to little kids. No explaining rewards and consequences when you're 3. Oh, honey, it's not nice to hit little Bobby on the head, blah, 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 blah. Oh, you hit Bobby on the head, you get a child. We can discuss it later, but we don't need to have those conversations with 3-year-olds. You're going to brush your teeth whether you like it or not. We're not going to talk about it. So that is what behaviorists would say with parenting. As kids get older, then we talk more with them. But when they're little, they need to know that I'm the judge, jury, and executioner. I brought you in this world, I'll take you out. When they're little. So I know that B is out. So now between A and C, okay, assimilated into the mainstream practice of counseling or avoided completely by insight-oriented counselors. Anybody want to take a guess? Put your answer in the chat box between A and C. Absolutely, it is A. Most of you use some behavior techniques. You do. If you've got a kid that you're working with, you teach mom and dad to set up a behavior chart at home. Some rewards and consequences. A token economy, right? You get so many points. On Friday, you get to pick out the toy chest. Behaviorist. So most of us use that. So again, when you're in session this week with a client, you know, hey, a behaviorist would do this. A behaviorist would say, we're talking too much. So knowing the verbiage of what you do already is really what's going to help you. So avoid it completely by insight therapist. Insight therapist means a Freudian or neo-Freudian. Most often a Freudian. Insight means I'm looking in unconscious to try to figure out what's in there, why you behave that way, and I'm trying to pull it out because everything is hidden in the unconscious. That's a Freudian question or a neo-Freudian. Okay. Sex is always Freud, but I can take this one out because I know that it is not totally avoided. Okay. So again, when I'm looking at the test questions, that's what I'm really looking at. I'm trying to understand what the question is asking me before I do anything else. Okay, let me go here just for a moment. Just because a lot of people struggle with this. Oh, my drive. Guys, I want to thank you for hanging out with me tonight. Normally, I have a boot camp on Fridays. I do have one next weekend, an NCE boot camp. That is from 4 to 4:30 to, I usually go to about 9, to be honest with you, but it is recorded. So if you want to consider joining that, if you're stuck taking the test soon, and also always just signed up for a couple of individual sessions with my staff. We know you personally, we get to know you, we coach you, we support you, and really figure out what you're doing. You will see that we don't ever sell a canned program because most of you own everything out there. We are not trying to get you to buy anything else but us teaching you. We'll give you all the material that we have. We could care less about material. Most of you have too many. I promise you just don't understand it. One of the other things I want to say is on the test, don't ever, ever, ever change questions. Don't ever change questions. Okay. Change answers. So when you're taking the test, what we say is if you're taking the test and you have a standard 4 hours, if you don't know the answer, what I need you to do is just flag it, but don't answer. Okay. Don't answer. When you're done, all you get to go back to is the ones you didn't answer. I don't care how much time you have left. Don't you dare go over that test again and change answers. Don't you dare. Don't answer them. Okay. If you can't flag more than between 17 and 20, because then we'll run out of time. Okay. Flag them. Don't answer. At the end, and especially if you have extra time, don't you dare go through that test again. Your anxiety will lie to you. If it made sense the first time, it's the right answer. Okay, don't go back. No one has ever come to me and said, Dr. Pam, I changed 6 answers and I still passed. If it made sense the first time, stick with it. Okay. So then this is operant conditioning. A lot of people struggle with this because it's a very different paradigm. It's a very different mindset. So what we know is Skinner said, if we like the behavior, we reward it. If we don't like it, the consequences. We do that by adding or taking away. Okay. It's that simple. It is not good or bad. Remember, it's adding or taking away. So you're adding people, or adding things, or taking something away. If I like the behavior, I am adding something. Probably what I'll say in a session. I'll talk about your spouse, especially if you still like your spouse and they still do it for you, right? So, you come home and your spouse made dinner. They vacuumed the carpet. They did something you've been dying for them to do. You like that behavior, right? You're going to reinforce it because you want it to happen again. So a positive reinforcement is giving them a little something. Don't just mean a kiss. You better take them all the way upstairs. Adding something, giving them something will most likely increase that behavior. The negative reinforcement is taking away something they didn't want to do anyway. Honey, you cooked dinner. I'll wash dishes. Oh, honey, you did the laundry. I'll fold the clothes. So that is taking something away. So the thing with these questions is to understand the behavior first. Understand the behavior. Okay, so I'm going to start off with an easy one. If you've been in session or probably in one of my videos, you might have seen this one already. So Johnny puts a quarter in the beginning machine and Johnny gets a piece of candy. Right? The first thing we're going to do is we're going to look at the behavior. Second time. I apologize for that. Okay. So we're always going to look at the behavior first. Got it. If we like it, we want to reinforce it, but we do it by adding or taking away something. So so it's a positive reinforcement. I'm adding something because I like the behavior. I'm adding something. It's not good or bad. Always think plus, minus, plus, minus. Okay. So then, if it's negative reinforcement, it's going to be taking something away. I like the behavior, but I'm taking something away because I something you don't like to do anyway. If your boss says, here we go. That's a question. No, you can't get a question. No, sorry, I can't listen to this one either. I'll give you a link, but this is no. So remember, material comes with paid sessions, not free sessions. So then what we know is that if we look at Johnny puts his quarter in the vending machine. He gets a piece of candy. We're going to look at Johnny's behavior first. Johnny puts his quarter in the vending machine. Will Johnny do that again? He will. He got candy, right? So he's going to do it again. That's a reinforcement. I like this. I got candy. I'll do it again. It's a positive reinforcement because the candy was added. Added. Okay. That's a positive reinforcement. If we talk about number 2, I put on sunscreen to avoid a sunburn. The behavior is I put on sunscreen. Will I do that again? Yeah, I will. That's a reinforcement. Was something added or something taken away? Avoided means something was taken away. This is a negative reinforcement. I'll do it again because I avoided the sunscreen. I avoided the sunburn, right? So I will put on sunscreen again. I like the behavior. It's reinforced. And then it's a negative because I took something away. I avoided the sunburn. People really struggle with these. So if you don't use these every day, you'll really struggle. Okay. You put your hand in a flame and you get a painful burn. Behavior. I put my hand in the flame. I'll do that again. Okay. Don't put you in the question. Most people wouldn't. Okay. So I wouldn't do it again. That's punishment. Okay. So then it can't, okay. So it's punishment, but it's not a punishment. It's not, it is. So whoever said PR, that's not correct. Okay. It's a punishment. I'm going to avoid it again. That's a punishment. And then whether it was something added or taken away, something was added. Yes, that's a positive punishment. Not good. Something was added. So you got to let go of whatever you thought growing up. And I teach this to FBAs all the time, functional behavior analysis, where people are doing the ABC. I teach it all the time. And many times they're just doing it wrong for the test. What you do in your everyday life is up to you, but the test doesn't care what you do. The test makes sure that you know what this is according to the test. A child misbehaves and gets a spanking. My mama said it was good for me when she spanked me, but I don't think this is what she meant. So the child misbehaves. That's a punishment. I don't like my children misbehave. The spanking is added. That's also a positive punishment. Very good. Very good. Okay. Let's go down. I like this one. Lindsay breaks the law so she can get free meals, free health care, and a roof over her head. What is Lindsay's behavior? She broke the law, right? She broke the law. Will Lindsay do that again? It's a reinforcer. Lindsay, all these things were added. Look, I broke the law. They fed me. They took care of my teeth. They took care of my whatever. And I got a roof. That is a reinforcer. It is a positive reinforcer. Absolutely. You guys, very good. Absolutely positive reinforcer. I changed my behavior because I like what was done. We can go down to the next one. Let me do this one. Yeah. 14. Angelina is convicted of breaking the law and goes to jail, which removes her freedom to do as she pleases. Now, Angelina is a little bit different up here than Lindsay was, right? Angelina is convicted of breaking the law and goes to jail. That's the behavior. Will Angelina do it again? No, it's a punishment for Angelina because she lost her freedom to do as she pleases. So this is a negative punishment. Okay, makes sense? Yes, a negative punishment. Yes, 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 yes. When you're finding these on the test, just be sure that you find the behavior first. Separate the behavior from the rewards and consequences. Okay, let's see what I like up here. Number 6, you come to work late regularly and you get demoted. Will you do that behavior anymore? No, it's a punishment. No, 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 it's a punishment. And it is a negative punishment. Yes, Jasmine, it's a negative punishment. Whoever said that. Rhonda, it's negative punishment because I got demoted. I lost my title. Something was taken away. It wasn't added. Okay. So again, what I want you to remember about these is remember it is, first of all, it's a reading test. I haven't said that to you 1,000 times. It's a reading test. So what I'm really looking for is knowing that I understand that it's a reading test. It's a reading test. So that if I add something or take away something, that is adding positive or negative, and the goal is to make sure that I understand what they're adding or taking away. Okay. If I like the behavior, stay with the behavior first. Okay. So this question says, which of the following is not an irrational belief according to REBT? Again, before I look at any of the answers, just don't look at the answers yet. Just know the theory. The theory is the A, B, C, D, A of REBT, right? And I always have to say it that way. So this is an offshoot of CBT. CBT is Beck. Beck said you got stinking thinking, girl. The problem is you just don't know how to think. What's his name? Dr. Phil said stinking thinking. Okay. So the goal is to look at the problem of where you think. So CBT, Beck said that depression wasn't real. He used the term Socratic thinking. Socrates is the Greek god, the thinker. Right? I have to throw in the fact that I was in Greece 2 years ago. Loved it. 3 years ago. 3 years ago. I was in Italy 2 years ago. Yes, I like to travel, by the way. If you watch my videos at all, I love to travel. My goal is to relocate my business outside the United States. And hopefully I'll retire, and I'm hoping October of next year. I'll be 60 in October. But I'm hoping so I can read that brick and mortar and just run my business. That's all I want to do. I want to do what I want to do. I don't want to work for the man. Work for me. Okay, so anyway, CBT is back. CBT is if I change your thinking, you got faulty thinking. I change your thinking, I'll change your feeling and therefore your behavior. So CBT is problem with thinking, and then I will change your feelings, and then I will change your behavior. Okay. DBT, Marsha Linehan, she said the opposite. Now, that's written for borderlines or for other people that struggle with emotionality, can't keep their emotions in check. DBT says, if I change your behavior first, if I teach you mindfulness, if I teach you how to have interpersonal relationships, if I teach you those things, then I can change your feelings and therefore change your thoughts. So CBT is thoughts, feelings, behavior. DBT is behavior, feelings, thoughts. And REBT is your irrational belief system. Okay. I know none of you, but I'm going to tell you about some clients that I work with sometimes. Okay. So REBT says that an event happens. I know none of you, but some people fail the test. Okay. So what happens is this event happens. I failed the test. The problem is you tell yourself, oh, and you know some people like this. I ain't gonna pick any fingers, but you know what? My mom was right. I shouldn't be a teacher. I should have been a teacher. I should have gone to nursing school. I'm not good at a counselor. I'll never be a counselor. I've taken this test 3, 4, 5 times, and I still can't get it. There's something wrong with me. That's your belief system. That leads to emotional consequences. You feel bad about yourself, right? You go to work and you're questioning every time you see a client because you think you don't have it. The D, so the A is the affect event, the B is the irrational belief about the event, and the C are the emotional consequences, how you feel, not about the event, but your own belief system about the event. You take the test, you fail the test. Your belief system is, oh my gosh, I knew I couldn't do this. I know I'm not good enough, smart enough, all that good stuff. And we feel that way. All of us feel that way when we first start. We all do. You fake it till you make it. Okay. I do a lot of public speaking. I'll be in Atlanta at the end of August at the Black Business Conference, and I'm talking about imposter syndrome. We all go through it. Okay. So then D, I'm going to come along when you join a session with me. I'm going to say, girl, will this test make you a better therapist? You're going to wake up the day after you pass the test and suddenly you're good? Oh, it's a stupid sheet of paper, Malone. It's a stupid sheet of paper. It will not change one thing. You will not be a better therapist because you passed this test. I'm sorry. So I'm going to say, hey, you remember that guy that sits a couple of cubicles down, or your boss that keeps asking you questions? And they got that alphabet soup after their name, but they ask you questions. There's not a relationship between passing the test and being a clinician. Those two things are not related. You're a good test taker or a lousy test taker. So I'm going to say to you, hey, you know what? You're right. You failed the test. You're absolutely right. You're a great clinician, though. You're just a lousy test taker. You haven't learned the skills to pass a standardized test that wasn't written for you. And I may have some people in the group that it may be, but remember, the test was written by rich old white men, and they speak a language that most of us don't speak every day. It wasn't written for you. So the problem is, it's not that you don't know clinical verbiage. You just don't know verbiage in general. You suck as a test taker. I'll give you that. But it has nothing to do with you being a good clinician. Those two things are not related. So the effective new consequence is helping you realize, yeah, you're right. I'm not a good test taker, but I'm a great clinician. The only thing that will make you a better clinician is time and experience. That's it. That's it. That's it. There are 17,000 different tests, LaTanya. So it's like bingo. So when we get a test, there has to be so much percentage in every single area. Okay. So so you're never going to get the same test twice. You may see the same questions twice or similar questions, but you'll never see the same thing twice. If we look at the 6 pay-crep areas, that's what you want to go by. If you look at the 8, you'll see that I had 17,000 questions in group. Oh my gosh, Dr. Pam. But I don't know they all counted in group. It could have been a career question in group. It could have been a code of ethics question in group. It could have been narrative therapy in group. So the goal is learn the content. There's no easy way out. There's no easy way out. I'm sorry. And you can take it 17 times and then decide you want to come see me, but there's no easy way out. You just have to put the time and effort. We say if you do it 90 days, once. Women, make yourself a priority. Everybody in your family should know Dr. Pam. And people pass, their kids like, oh, we're done with Dr. Pam. Yay. No more Dr. Pam. Yay. Everybody in your family should know me. I should be in your kitchen. I should be in your bedroom. I should be in your car. Okay. That is the goal, is make sure that 90 days, make you a priority. If that's the most important thing, if you apply this to everyday life, you'll get it. You'll get it. Or you can half-a study for like next 2 or 3 years. That's up to you. And y'all know some people, right? Okay, so let me go back to my question. Okay, so again, remember, what I'm trying to teach you is content. If I teach you content, you'll understand everything about the test. You're not guessing because you know the content. Which of the following is not an irrational belief system according to REBT? I know that irrational belief systems are irrational. They don't make no sense. You know, I got married for better or for worse, and my husband cheated, and he's like, oh, why are you divorcing me? You said for better or for worse. Are you stupid? What? It's irrational belief system. No, it don't work that way. Okay. We see it in drug and alcohol also. So my drug and alcohol people really look at, I'm clean. I've been clean for 6 months, right? Labor Day's coming up. Remember, my family's holding a party. I shut the little family party on Labor Day. And you know what? I get drunk. And then I get pulled over. I get a DUI. And instead of just saying, oh, I did something, my belief system is my mama shouldn't have served alcohol. She knew I was an alcoholic. She knew I had a problem. Why did she serve alcohol? That person is in denial. They haven't taken any ownership for what they did. Okay. So the goal is that if I this is what I believe, that I didn't do anything wrong. And then I'm mad at the judge. I'm mad at my mom. I'm mad at everybody else because I've taken no ownership for my behavior. I'm going to come along and say, oh, yo, dude, hey, had a free weekend where you go, there's no alcohol. Did you tell your mom that you didn't want drinks around? What did you do? So the goal again is he would effective no consequences. He would understand that he took that. Okay. So I can tell you that all of my tutors have been trained by me. So what happens is they were in a group like this. They did really well. We liked their personality and we asked them to come tutor for us. Every one of, I think I have 2 maybe that didn't, they all have their license. I think I have 2 that maybe didn't get trained by me. They went through another way and we found them kind of in a job search, but everybody else has been trained by me. So they are wonderful. They are absolutely wonderful. I will tell you that my rate is higher than my tutors. I usually have a waiting list. So my rate is higher, but all of they would not be on my staff if they weren't great. They would not be on my staff if they weren't great. Okay. We do understand that personalities are different. If you find someone that you don't like their personality, we can look at that. But again, they teach the way that I teach. Okay. So which of the following is not an irrational belief system? It's a not question. When I get a not question, I'm looking for the 3 things that are. Okay. And if I'm stuck with these, I'm trying to figure out one of these things is not like the other. Which one of these things doesn't match? So A, that was aggravating, but that's okay. B, my feelings are hurt. I can't stand it. C, I lost my job again. Life is unfair. And D, I lost my favorite pair of sunglasses and my whole life is ruined. Let me put this in the chat box so everybody can see the question. That's that last question. I don't know what that one is. Copy. Yeah. Okay. Sorry. Oh, they're all marked out under that question. I don't know why. Okay. So, which is not. So whenever I have not questions, I start off with what's right. So that I know that D is an irrational belief. Okay. I may have felt that way someday. Not gonna lie. I went in last year. I went to I love the beach. I love the beach. I'm a water person. Last year I went to Panama City, and I had a pair of Prada sunglasses that I bought in Italy. It wasn't they were Prada, but I bought them in Italy. Okay, I ain't going back to Italy anytime soon. I did cry. Did cry. I wasn't in the water. I just had them stuffed in my bathing suit and taking pictures, What is it, baby? So that is a rational belief. Okay. Oh, this is Princess Milan. I have two Shih Tzus, and Princess Milan thinks she needs some attention. So I'm definitely taking D out. Okay. So again, when I see these questions, I'm looking for the ones that I know are true. I lost my job. Life just isn't fair. Yeah. Okay. So then that's aggravating, but that's okay. My feelings are hurt. I just can't stand it. So I took B and D out. I always want you to follow the same process. Even if you know the answer, follow the process. The process will help you go through all four questions and not just pick an answer. So now you're between A and C. So this is based on REBT. One of these is and one is not. Okay. So my correct answer is A. Yeah, it was aggravating, but I'll survive. So that is not an irrational belief system. That is not. Does that make sense? So I'm teaching you test taking skills of how we pass a standardized test. It's a reading test. It's a reading test. They're giving you answers. They're giving you hints in the question. Always, always, always. And those of you that are using the purple book, I'm sorry, you'll find that that is just not the way the test questions are written. Okay, let me pull up some more, guys. Is bartering acceptable? Anybody want to answer that in the chat box? Remember, people that barter are not poor. Bartering is acceptable if it's a small community. If it's a small community and everybody else uses bartering as well. So let's say that, and I've worked with clients who are in the middle of nowhere. There are like 20 people, okay, maybe 30 people in town. And they're not only are they the counselor, but they're also like the town librarian, all those things. Bartering is okay if it's the question is going to tell me though. It's going to say it's a rural situation and it is the client has to ask for it. And then it's also something that every other professional takes. Okay. That is the goal, is all the professionals have to take it. Okay. So let me show you this question and let's kind of look at this. So bartering is not the same as taking a gift. Bartering is payment. Okay. So then what I know is it is payment. And the Code of Ethics says in occasions it's okay. Before I post this, remember that I can take a gift. I know your agency had some rules. It's got to be less than $25. It's got no. It does not say that anywhere. What it says is I have to take into consideration the dollar amount. It has to be a small amount, but that small amount is not determined by me. It's determined by the client. If they're Asian and they give me a red envelope, the red envelope is Chinese New Year. They give thousands to people. They give me $50 in a red envelope. I'm going to keep it and say thank you. That's a cultural thing. I'm never going to offend my clients. Remember, it doesn't matter what your agency rules say. The Code of Ethics don't say that. The Code of Ethics says, I'm going to look at the reason the client wants to give me the gift, the reason I want to take the gift, and take into consideration any cultural implications regarding a small gift. If it is food and culture, you better take it. Y'all know y'all Americans, we ain't eating them other people's food, you know, them Asian, them Korean, them whatever they are. We go eat their food. It all tastes like chicken. Get over it. Okay. So the goal is you're not going to hurt your client. That's not okay. And especially us as Americans, right? I tell my students, my young students again in school, I tell them, you better sit at that table. Bring a doggy bag, move the fork around, pray they have a dog. Okay, but you better sit at that table. If you're working with somebody and you're in their house, Mnuchin talked about joining, right? You join the family. Don't you dare hurt their feelings. Don't you dare. Okay, suck it up and pretend. So here's my bartering question. Okay. In most cases, bartering should be avoided as a means of paying for psychotherapy. However, bartering may be permissible in all of the following cases, except when. It's one of those except questions. And remember, on the test, it's not always in big letters. The key is when I'm looking at the 4 answers and those 4 answers, I'm lost, go back to question. You're lost in question. Okay. I'm not going to read this one. I'm going to let you guys figure it out. Give me some answers in the chat box. Be brave. I'm going to read the question just for my people that are driving. Okay, so in most cases, barter should be avoided as a means of paying for psychotherapy. However, bartering may be permissible in all of the following situations, except, remember, that means 3 are right. 3 are right. I'm taking out the 3 that are right first. Both the client and the therapist sign a written contract. B, the client is facing a significant financial hardship. C, bartering will not exploit the therapeutic relationship. Or D, the client requests to barter. It is not D. D is a rule. They have to ask. I can't come up with it. So D is one of the things that is okay. They have to ask. Both the client and therapist have to sign a contract. Yes. So between B and C, one of these things is okay and one is not. And this is verbatim code of ethics. Read the code of ethics. I cannot tell you how important it is to understand it for yourself. Not what your boss said, not what your agency said. Your agency may have different rules, but what does the code of ethics? There are states that have different laws. The test doesn't care about the laws in your state. The clinical exam we all take. If you had to take a legislative or a state and local test about the laws, that's different. The jurisprudence test. In some states, it's illegal to sleep with a client. Not in every state, though. It's unethical in every state. Okay. And remember, there's a 5-year window. You can't be sexting for 4.5 years. Oh, baby, I can't wait. 5 years almost up. You so hot. And now we get together. What? You happen to run into each other 5, 6 years down the road. It's okay. 5 years, and that is a code of ethics. Whenever you see a question, and if one of the choices is follow state and local guidelines, I like that because that really means that it's a state issue or a local issue. When it talks about keeping records, the best answer is follow state and local guidelines. Some states have 7, some states have 5, some states have 10. It depends on the state. Remember, everybody takes the same test. Okay. So my best answer is B. They are not poor. They're not poor. I'm sorry, I didn't do that. I cannot exploit them. I can't be taking a whole side of beef for half a session. You know, if I'm charging $250, I can maybe take like 3 filet mignons, right? 60, there's about $6 in the restaurant. Not if he's got some Wagyu beef, he's having some Japanese beef. Yeah, I might get like 2 filet mignons, right? But I can't take the whole side. I can't take his best chicken that puts out the eggs. It has to be that I am not hurting him. I cannot exploit the client ever. Okay. I'll put a couple other here. If you want to ask me any questions, feel free. You can put in the chat box. You can ask me out loud. Just ask. I hope that you find today helpful. We don't do these very often. Our goal really is to get you to understand that it's a reading test. If you learn content and learn how to, you'll get it. Okay. Those are the most important things is content and then how to apply it to a question. That's what I hear so many times. I didn't see any Freud questions. I didn't see. Yes, you just right. According to Freud, people struggle to find a balance. Again, I'm not going to answer. Okay. A, between neurotic and psychotic defense mechanisms. Gnarly. Broaching is when it's a socio-political issue. Okay. Socio-political means that I am if someone is LGBTQIA, if someone is something that politics or their ethnicity is an issue in their area, I'm going to bring it up in therapy. I'm going to bring it up in therapy. I'm going to not going to bring it up. I'm going to bring it up. Okay. According to Freud, people struggle to find a balance. Okay. It's a Freudian question. I'm thinking unconscious, Freud, sex, Freud. That's right. By looking at the answers. That's what I'm thinking about. Between neurotic and psychotic defense mechanisms, between sexual expression and expectation of authority figures, between the Oedipus and the Electra complexes, and D, between sexual drives and socially acceptable behavior. It's a Freud question. It's unconscious. That's where I'm at. Okay, so I'm going to rule out first. So now Dr. Pam's not in the test with you. I'm trying to be in your head, and you're going to rule out first. Okay, so we're going to rule out and then tell me what the answer is. Put your questions, answers in my chat box, guys. According to Freud, people struggle to find a balance between you're going to rule out A. So defense mechanisms are normal. They're not neurotic or psychotic. They protect me from things I'm not ready to handle. That's just a fact. They're neither one. Okay. The Oedipus and the Electra complex. The Oedipus is the boy, right? The boy is in love with his mother, and he's afraid that his father's going to find out. And if his father finds out, he's going to chop off his little penis. So if you see a question, a boy has to have surgery, and they're going to put a needle in his groin. He ain't worried about the pain. He ain't going to wake up and his little thing be gone. The Electra is the girl. The girl is in love with her father, but she has penis envy, according to Freud. She wants to have penis like her dad. Okay. This stage ends up by identifying with the same sex parent. Remember, Freud used fixation. You get fixated in a stage. So if you're an adult and mama didn't satisfy your mouth, right? She took the nipple out of your mouth too soon. As an adult, you're trying to put things in your mouth. You're stuck in the oral stage, fixated. Erickson used the term crisis. Verbiage matters. Got it. So C is the phallic stage, Oedipus and Electra. So between B and D, okay, someone tell me, D is the answer. What are other words for D? What theory of this of Freud's is this? The sexual drives are what? I know they're sexual, but my sexual drives are my id, ego, and superego. Yes. Dr. Pam, I didn't see any of those questions on the test. Yes. Your id is your pleasure principle. Eat, sleep, and have sex. Ooh. Yes. Oh, I'm like, hey, he fine, right? Let me go out. Freud said we can't live if we don't have food, if we don't have sex, if we don't procreate, right? So that's my id. My super ego is my angel. My super ego says, Pam, don't touch it. Don't look at it. Girl, you got hair in your palms if you touch down there, right? My id is my devil. Eat, sleep, procreate. My id wakes up and says, oh my gosh, we should have like pizza with eggs for breakfast. Nothing better than leftover pepperoni sausage pizza with some eggs and spinach on top in the morning. Put in the air fryer. My super ego says, girl, have you looked at your butt? Do you know you can eat that? No. It's like, but no. My ego is my reality principle. The ego is what keeps me in check. Ego syntonic, ego dystonic, ego defense mechanisms. Erikson said the last stage is ego integrity versus despair. For my NCE people, Tiedemann and O'Hara line up with Erikson. That last stage of Erikson, the last stage of Tiedemann O'Hara or Tiedemann Miller, my ego is integrated into this job. Okay, Freudian terms. So my D is my id, my sexual drives, and social accepted behavior is what my super ego says. So that's the fight, right? And my id has to balance both of them out. Yeah, if y'all know me at all, you know my id suffers. Woo! My id suffers. It just my ego has to work super hard because my id's like, you sure? Okay. According to object relations theorists, believe that development and individuation depends on. What theorist is this? Who is object relations? Mailer, yes, Margaret Mailer. I guess somebody's going to pass in the house. Absolutely, Margaret Mailer. Margaret Mailer says that if we don't have a relationship with that one caregiver, that one person between the ages, but between 2 and 3, then we will grow up not trusting the world. So that first stage of Mailer is called, she called it autism. But remember, she wrote this theory a long, long time ago, way before autism was a thing. So you might see some of the test questions that talk about fusion instead of using her verbiage, which was autistic. So she said, if we go through these stages, and as long as we have the same caregiver, we'll turn out okay. Yeah. Any social workers in the house know that Margaret Mailer also has a theory on love and romance. So if you're a social worker, make sure that you look up that theory on love and romance. Okay. So then Margaret Mailer has these stages. She called it fusion. Remember, she was in the 1800s. She was the same time Freud was. This is a long time ago, early 1900s. So autism wasn't a thing. So you might say normal autism or fusion. Those first 3 months of life, babies just don't get that they're a separate person. They just don't get it yet. Now, between 5 and 10 months, it's individuation, separation, differentiation. They all mean the same thing. It means I realize I'm a separate person from my mom. Oh, look, she's there and I'm here. So then rapprochement is about 18 months. That means I'll go further away from my mom, but not quite letting her out of my sight. And consolidation is when I've developed object constancy. She is that neo-Freudian. That means unconsciously, I know I have a safe base. Unconsciously, I know somebody's got my back no matter what happens in the world. So that is Mailer. Object constancy is Mailer. Object permanence is Piaget. Piaget is the peekaboo game. On the NCE, there's usually a question that talks about a little boy puts on a boy sees his big brother put on a Halloween costume and he thinks the brother disappeared. Okay, because Piaget said, hey, out of sight, out of mind until 6 months. So this is Margaret Mailer. Object constancy. She's a neo-Freudian. Unconsciously, I know that I have a safe space. Now, remember, so if I didn't develop that, she said that's where borderlines come from. Right? Borderlines hate you, hate you, hate you, love you, love you, love you. They have dichotomous thinking, black and white thinking, no gray. DBT is the right answer for the test of how we treat borderlines. She also said that conduct disorders can come from that. My conduct disorders, we diagnose between 6 and 16. The difference between a conduct and an ODD person is the conduct disorder has no remorse and it's broken the law. You're going to see in the question, he steals lunch money. So Brittany, he's not diagnosed to antisocial until he's 16. So personality disorders are usually diagnosed at 18. However, antisocial and bipolar and borderlines can both be diagnosed at 16. Absolutely. 6 to 16 is going to be conduct. And now I turned 16 and I still got the same behavior. I'm beating up people. I got no remorse. Let me go back to my kids. The question will say, the little boy is poking the dog's eyes out, trying to set the cat's tail on fire. Yeah, that ain't okay. They don't know empathy. They don't know when they hurt somebody. Many of my pedophiles are antisocial. Remember, asocial means I don't like people. That's not a clinical term. Antisocial is anti-society rules. That's my Jeffrey Dahmers of the world. Those are my pedophiles. When he says, she was 3 and she wanted me. Okay. They don't get that their behavior hurts somebody. They just don't get it. Okay. So understand that asocial is not a clinical term. Antisocial is a clinical term. Those are my sociopaths. They're friendly. They're so nice. Yeah, Jeffrey Dahmer, right? Yeah, if you watch the movie or Lift it, there was a bloody head in there, and he moved the bloody head out of the way, and he got the guy. It's nice to him right before he killed him. Just saying. Okay. So if anybody calls you antisocial, what I say is just prove it. Find the bodies. You can't find the bodies. You can't prove it. I am not asocial. Asocial is not a clinical term. The avoidant personality disorder, those are people that are afraid of being ridiculed. That's a term. Asocial is not a clinical term. Educate your friends, because that is not a term. Okay, so I went through object relations theory. Now we're back to the question. Again, this is how I want you to study when you are studying the test. If you want to Google, be sure you put in that question plus psychology, or the theory plus psychology or counseling. You need to understand it from our viewpoint, okay? So then, object relations theory believe that development and individuation depend on what? Again, I'm always going to follow the same process. I'm going to understand the question, and I'm going to read all 4. A, the ability to develop positive self-esteem. B, the nature of early relationships. C, compatibility between the self and the ideal self. And D, biological predispositions. I'm going to rule out, even if I know the answer. I'm going to follow the process. That means I've touched every single answer. Okay. So then, I'm going to rule out, I'm going to start with ruling off biological predispositions. There's some belief to that, right? Belief that there's some biological piece. When it comes to drugs and alcohol, when it comes to schizophrenia, we definitely know there's a biological piece, but that's not what Margaret Mather said. Okay. I ruled out D. Can I rule out anything else for sure? But what can I rule out? And I want you to learn this process. It keeps you from just going to what you think is the answer and really focusing on all 4 choices. C, ideal self and ideal self. Absolutely. That may belong to Carl Rogers. It also could belong to Adler. Adler talked about superiority and inferiority, birth order guy, family constellation. So now between A and B. Okay. So what I said to you earlier is focus on having that one consistent caregiver. And I don't mean dropping your baby off at daycare. That is not what I mean. What I mean is when in the real world, what I talk about is we've got this teenage girl, right? And she's trying to get through school, and everybody's pitching in to watch her baby. So 6 months with the baby daddy, 6 months with my mama, 6 months with somebody else, and they're all helping me trying to graduate from school. So now when I'm 18, I'm finishing high school, the kid comes back and he's 5 or 6. Yeah, he hates me because he's never learned that somebody always has his back. Never. Okay. I'm going to do about 2 more. It's 7. So I'm just going to do about 2 more. This is a group question. Oh, hello. Gotcha. Okay. So what I want to do, Jennifer, you can have anything I do. So, okay. So the goal of this question, it's a group question. And so many times we have to learn content, whether it's in group or individual. I have to know what a theorist would do, no matter what they're doing. A narrative family therapist would do what they do. A Freudian would do what he does. Okay. If you remember, I'm going to remember the stages. I always teach Tuckman because that's how I grew up. So Tuckman is forming, norming, storming, forming, norming, storming, performing, and then it's over. For my NCE people, I've got both Corey, and Yalom. Yalam's first stage is orientation. It matches up with forming. And then he's got conflict. That's a normal part of group. People are going to fight. Sit back and relax. Unless they're throwing chairs, it's part of group. So Corey calls it transition. That's actually Corey's third stage because his first stage, there's no people. That's pre-group. So the third stage is transition. Okay. And then the other ones are knowing that all three of those stages are the same. So I've got to know all the theorists. But in the storming stage, it'll pass. They're jockeying for positions. They're trying to figure out who's the big dog in the group. Unless they're fighting and physical fighting, it's okay. Tuckman says that the first stage is going to be, Tuckman says that he has the norming stage. Remember, I set the group rules, but the norms are set by the group. Every group has different norms. So this question is about norms. Okay. Randa, because if you watch my older YouTube videos, they were pretty plain, focused on content, because remember the test changed in March of 2019. So I changed the way that I teach and the content about around that time. I was really hoping they would keep that test easy during COVID. I really was. But if you watch anything new or attend a live session, the test questions are not black and white. They're just not. They used to be. It's called Bloom's taxonomy. If you're in education, Bloom's taxonomy talks about our higher level thinking skills. The test used to be recall. It's Freud. What are Freud's stages? It's not that anymore. It's higher level thinking. You have to apply, synthesize, and evaluate. It's a very different test than the Purple Book was written for. So if your professor says, hey, it's the Purple Book, don't start there. Please don't start there. I used to say just run from it. But at least if you start, we recommend the Hellwig book or any material that we recommend. Any sessions with us, we provide material. Stop by materials. If you pass the test, you don't need more material. You need to understand the material that you have. And if I ask you a question and you tell them verbatim what the textbook says, that means you don't understand the question. Remember, you do this all day, every day. I'm giving you the verbiage for what you do. So, a head injury rehabilitation group meets 3 times per week. Let me put that in the chat box as well. Nadine, I'm guessing that's why you're in my group, because that's what you use. I don't know that for sure, but if I had to guess, that'd be my guess. Just saying. Let it go. And Pocket Prep is not a study guide. I tell my clients, don't buy Pocket Prep until the month before you take the test. That's all you need it for. Spend $24.99 for 1 month, because all you do with the questions is you keep thinking you're getting better, but you're not. You're just memorizing them. And the odds of that exact same question being on the test are slim to none. Learn content. So a head injury rehabilitation group meets 3 times a week. One patient tells a fellow member that she is not working hard enough in physical therapy. The group's informal norm, that means everybody agreed. The formal norm is that critical or negative sentiments are not to be expressed on Friday. The norm, I didn't tell them that. I set the rules, but they agreed. Everybody in the group said, hey, this is what we agree. Person agreed. They have found that members are often distraught and cannot deal with such issues over the weekend. With an angry edge, members of the group aggressively correct the member. The social worker, the counselor, the therapist should do what? I'm going to go back to my question, okay? I'm going to tell you, Miriam, you have never seen a question like this in the Purple Book. There's simple recall And the test isn't written that way. Okay. I do say after you learn content, go back and learn content. I suggest you study with us. I suggest you get a couple sessions. We'll provide you the material and we'll teach you some stuff. One and done. Let's help you. I have an excellent staff. Excellent. We have a 96% passing rate. If you follow our rules, girl, we good. Okay. So anyway, go back to my question. So I know that it's a group. I know they're in the norming stage. So that means they know each other pretty well, right? They're tight. They set the group norms. They're tight. The forming stage, they're all looking at me, asking me questions. The storming stage, they're saying, Dr. Pam, you ain't never done drugs. How the heck you know about drugs, right? Remember in those groups, when they say about asking about your personal life, you turn it back on them. Well, tell me, how does that affect you? So it doesn't really matter if I'm a drug user. We're trying to help you. That's resistance. That's the storming stage, storming transition or conflict. Okay. So then now I know the group, they're mad. Set this rule. And he's mad. Now, what do I do as the counselor? One, reflect with others that his comments were inappropriate for a Friday session. 2, encourage the group to examine why his behavior is unacceptable. 3, indicate the group is being rigid. Or 4, support members while also allowing group members to express their feelings. Okay. So I see some 4s, but I will make sure that we touch every question before we just go to 4. We follow the rules all the time, even if you think you know the answer. Okay. So I've got one group member. They're tight. They know each other. They're tight. So then I need to support him but reminding, hey, dude, you're great. So that makes 4 my better answer. I'm not going to ask why the group is rigid. So the term rigid belongs to structural family therapy. I hear that word, rigid boundaries, rigid triangles. Triangles belong to Geneagram, Bowen. Okay. So that word gives me like, okay. Girl, I want to challenge you. I want you to pass this test. Don't get the test and be prepared, not prepared. One and done. Don't waste 275 a time. Shoot. That CR, that voc rehab test, that one's 375 a time. I can't afford to keep buying new material. Just let me learn. Okay, so I'm going to take out, encourage the group to examine why his behavior is acceptable. I'm going to take that out too. Okay, they're mad at him. I can't let them beat him up. I can't. So that gives me 4 being the best answer. Everybody get that? You want to question that? You want to talk to me about that? So you see that Miriam, I suggest that you try some individual sessions with us. A boot camp is 4 hours and we go over the major topics, but in an individual session, we can go over what you're missing. That's why we don't sell a program, because everybody is different. We're going to tell you what you don't know, specifically just you. That's what makes us different than selling. We're not the purple book. We're not pocket prep. We're not selling you a program. We're selling you an excellent coach and mentor and someone who will walk you through the program. He'll help you to understand why those are the right questions. He'll make sure you understand content and hold your feet to the fire. If my coaches tell you that you better study these theorists this week, next week, you better study them. We hold you accountable. Okay. So we are not cheap. I'm not ever going to pretend that, but we are worth it. Invest in yourself, mamas. Invest in yourself. You're worth it. You pay all the time for your kids' little soccer coach and the t-ball coach, right? And the learning coach. You pay all the time for your kids. You're worth it, mamas. Daddies don't usually have that problem. And I'm sorry if my daddy's in here. My daddies say, I'm going to go study and close the door. Mama's trying to say I'll go study and like, nah, and them kids knock on the door, right? That's why I say, play me on your TV. Your kids should know me. Your kids should know my staff, right? Dr. Pam. On my Facebook page, one of the questions is a sticky note, and this is a couple of years ago. And the question, the person wrote, the kid asked, who's your favorite YouTuber? And the kid said, Dr. Pam, because mom had listened to my YouTube channel so much. Okay, I'm gonna give you just a couple more questions, only because I don't have a life. I remind you, one day I'll have a life. 6 figures, 6 feet tall. He's got to be older than my oldest child, so 33. I like them tall and dark, and I need insurance. Just putting it out there. 6 feet tall, 6 figures, older than 33. And that number keeps going up every year. Like, oh my gosh, my kids keep getting older. What? Let me do. I'm spending the majority of time on the Theorist because that is the meat and potatoes of what you do every day. That's the meat and potatoes of this test. So whether it is a group, a family, or whatever, I have to know the verbiage of the Theorist. That is so important. I've got to know defense mechanisms. There's going to be 1,000 defense mechanisms over there. Know which ones you use. Right? I love intellectualization. Intellectualization means that when it's hard, when my kids were sick, instead of dealing with it with emotions, I just thought about it. Right, I went to WebMD and Googled some stuff. That's my defense mechanism. Freud said they protect me from things that I'm not ready to handle. Okay, so we all have them. Recognize them in your clients. Recognize them in yourself. Reaction formation. Right, that is the one where I hide what I'm feeling. I'm going to always be doing something to hide what I'm feeling. So this is the only one. And if I offend anybody, it's okay. You remember things when I step on your toes. You remember things that are associated with feelings more than anything else. But if you got that preacher, that preacher, and every time you see him, the only thing he ever talks about is how homosexuality is a sin. I'm just saying, okay. There's a lot of stuff in the Bible you can preach about, but that's all you ever preach about. You had some preacher, you had something. Just saying. Okay, you might see questions about LGBT community. Someone who he's in love with his male roommate, and he goes out and he protests. He fights at LGBT rallies. He beats up gay people. Okay, again, knowing theories. Okay. You're working with Noah. I'll put in the chat box. I'm going to tell you, Nadine, I'm also a widow, and I got my PhD, and my middle school one was at home. And I tell you what I'll tell everybody is first of all, I spent a lot of time in the bathroom crying. I thought I had brain aneurysm because it was so late and I couldn't process. My husband died in January, and I used intellectualization. I went to get my PhD in March. Okay, so yeah, that's how I dealt with it. I just went with the feelings. And my girl, she's my youngest, and she was only one at home at the time. And there was a whole this night, I'd never forget this. She said, "Mom, you don't need a PhD. You need to help me finish middle school." I sucked it up and I didn't say anything, and I went and helped with her homework. And I went in the bathroom and cried for about an hour. And then I got back up and continued doing what I was doing. One of the things that is so important to me, and I have a son too, but to teach my daughters, is that as a female, I'm important. We aren't taught that as little girls. We're not taught that. I'm old, and maybe the next generation is. But at my age, I was taught to be a good wife. I'm a Southern girl, right? You get married and you respect your husband. That is what I was taught. That's how I lived my marriage. And I was not going to teach my girls that. Genogram, I was going to differentiate, stop that emotional fusion that Bowen talks about, because I wanted my girls especially to know they're important. And their wants and their desires are just as important as anybody else's. And no matter what I say, they mimic what I do. So while it was really hard for me, and I'm not going to lie, I'm going through this, like my husband died, my life fell apart, I'm trying to get a PhD, and I got a kid that's in middle school. And my kids are suffering. It was hard. It was so hard. But that's the one lesson that I wanted to teach them. And when they're adults, I want them to know you're important. If your kids are on the back burner for 3 months, and that's all I ask you to give us is 90 days, they'll be okay. The house will be okay if it's a little dirty. They can eat hot dog, gas station hot dogs. That's a joke with my friends because my kids, I was the crock pot mom. We never ate fast food. Girl, when I was getting that PhD, them gas station hot dogs worked just fine. Okay. So, but it's not forever. 90 days is all I ask you to give us. Make yourself a priority for 90 days. You pass on what you do, not what you say. You're planting seeds. Tell your girls especially, and I'm not prejudiced against boys. I think boys learn that. Boys, I'm important, right? I'm gonna go find my career, do this thing. Don't be sorry for my loss. I would have killed him. So God knew what he was doing. Just saying. I would have killed him. So, but honestly, mamas, daddies, teach your daughters that they're important. Their thoughts, their beliefs, and what they want. They can have whatever they want. They just got to put the effort to it. Please do that. That's the most important thing. Okay. So yeah, I would have killed him. God took care of that. So, okay. So that's my question. You're working with Noah. He's a 32-year-old male referred to treatment because he struggles with depression. Noah states that he doesn't feel depressed when he's with his girlfriend, but he feels depressed whenever she's not around. He states that he hates it when she travels for work and that he feels extremely unmotivated when he's home alone. As a solution-focused therapist, how would I intervene? I have to know the verbiage of solution-focused therapy. Solution-focused therapy is the miracle question. You woke up tomorrow and the miracle happened. So I come in and I say, yo, I'm depressed. My solution-focused therapy doesn't care why I'm depressed. He doesn't care about the problem. All he wants me to do is you woke up tomorrow, Pam, and you weren't depressed. What would it look like? I would say, hey, my 10 would be, I'm at 5 o'clock in the morning, singing with the birds, jogging. Okay, that ain't never going to happen. But so that would be my 10. Every time I come in to see him, he's going to say, how close are you to your 10? Solution focus is brief, 6 to 8 weeks. I don't care about your childhood. We got 6 to 8 weeks to focus on what is going right. This is the only therapy that doesn't follow the medical model. Thank you. The medical model. The medical model is when you go to the doctor and the doctor says, what's wrong? Every other therapy focuses on what's wrong. This one focuses on what is right. Okay. So then, words, verbiage that belongs to narrative family therapy. The accept question, the scaling technique, and the miracle question. That's the verbiage that belongs to solution focused. Okay. So now, can I zoom out? Does that mean you want the question to be smaller? Is that what it was? Did I put it in your chat box? I put it in the chat box as well. I think I did. Yeah. Okay. Can you all see that? Okay. So then, like I said before, when I do this, the first thing I'm going to do is I will understand the question. I understood the question. I understood the assignment, right? I said to you the words that belong to solution focus. You know that because when you take the test, you're going to be studying. You're going to be all up in this video and these videos and knowing. I've got a couple on knowing your theorists. So those are free ones that are out there. Okay. The theorists haven't changed because they're all been dead forever, except for reality therapy, and Glasser and Marshall Linehan are still alive. Okay. All y'all people that picked D, you suck. You didn't read the question. What you did is you saw scaling and you said, oh, that's scaling. You didn't read the question. It is not D. I'm going to take out A and I'll take out D as well. Go back to the question. What does the question say? When they mention words in the question, there's a meaning. By the way, A is the paradoxical approach. I tell you, you can only be depressed for 3 hours this day. Okay. So then I said 3 words: scaling, scaling, your 10, and the accept question. Let's go back to the question. The question says, it says to you in the question. Noah states he doesn't feel depressed when with his girlfriend. but feels extremely depressed when she's not around. The miracle talks about when is the problem not a problem? The accept question. I'm depressed all the time, except. Do you see what my correct answer is? Do you see why you're missing a test? Because you said, oh, solution focus is scaling. I know that word, but you didn't read the question. If they go out of their way to mention to you the time he's not depressed, hint, 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 it's a reading test. Does that make sense? Does that make sense why you might not be passing the test? It's just thinking and not reading. You have to read it. When you get down to 2, roll out, follow the process. And this is exactly what you did. And I don't know who said what. I don't really care. But again, we tutor so many people. This is exactly what you did. You saw a word that you knew belonged to that theorist, and you just picked the answer. And you'll come back to me and say, Dr. Pam, I failed. I had solution focus, and I know I got them right. No, you didn't. Okay, so it's a reading test. Prove it to me in the question. You have to understand the question. Whatever words they put in there, they're in there for a reason. Prove it to me in the question. Okay, so what happens? You get down to these 4, and then you're like, oh, what do I do? I don't know what to do. You just compare the 4 to each other, but you don't go back and prove it in the question. Make sense? Okay, I got to go. So I hope you enjoyed hanging out with me tonight. Again, we have boot camps, we have individual sessions. I don't want you to spend one more dime on a piece of material. Please don't. Please don't. Buy more material ain't gonna make you better if you don't learn the content and you don't memorize it. You can't memorize it. You do it every day. As you're learning the theories, apply them every single day. The only ones you really can't apply are going to be questions about a career, because that's history. The only one we still use, remember, is Holland. Holland is Reasac, and that's the only theory we still use. But super, right? Super happened in the 60s. Super said you should be in your career by the time you're 24. That work out for most of y'all? I don't think so. Okay, it's been a pleasure. You can find us. You can just actually put in Dr. Pam on our YouTube page. You can Google Academic Coaching for World Changers. We have a Facebook page. We're on social media. You can find us. Our email, I'll put our email in the chat box. Our email, of course, is drpam, drpam 2020@gmail.com. But remember to subscribe to our YouTube channel. You'll definitely find that we release videos. Also, my podcast channel, I think that's like $20 a month. I'm not really sure about that price. I'm not going to lie. However, the podcast is really just one-on-one, me talking or me interviewing someone who just passed. So if my group settings are too loud for you, check out the podcast channel. You might like that as well. And just join us for an individual session. We'll work on what's best for you. Invest in yourself. You're worth it. Bye, guys.